Hi, Dr. Tamaru. Welcome. So today's conversation is part of a series we're building called Build What Matters, where we connect leaders who are bringing real value to FQHCs and the communities they serve. Today, we're going to talk about immersive care, digital care environments, the rural health transformation program, as we know that's something that everyone's talking about, and how you're looking to bring value to the FQHC world. But for those people that don't know you, if you wouldn't mind introducing yourself and telling us a little bit about yourself and how you got to actually starting the OneRoom Health venture that you're operating today.
Yeah, no, great to be here, Alex. Thanks for inviting me, and I'm really excited to share a little bit more about what we're doing with immersive care technology. My background is a family physician, as you know, but I practiced for over coming up on 30 years now, so I've been around long enough to see some changes in healthcare. And one of the things that I also have served on the board of directors for a company that serves tribal nations across the country. They provide healthcare capabilities and services for tribal nations, and it's designed to really help them build services to help their community and be self-sustaining. So, revenue is very challenging in these communities, and we help them build a revenue-generating healthcare business while serving the local community and their tribal members. In that whole process, we ran up against a lot of issues around how do you deliver care in rural America. Tribes often live in very rural reservation areas. They may have a surrounding community in there that they serve as well. And they're faced with all kinds of challenges of just access to care, getting access to the right type of care and specialists, as well as timely access. And they've always been trying to do it the old way, try to get a doctor to come out there, visit, pay them a lot to try to relocate. Often they come, they leave, or you're just going through a kind of a constant change of clinicians in your community, or you have to send that patient out, and that gets very expensive and time consuming, and often people don't go. So we actually started to noodle on that problem, say, what if we could create technology that is seamlessly built into a clinic and take an access point in healthcare that exists today and expand one of those rooms, an exam room, and build a digital capability in that room that now allows you to bring anybody to see that patient in that community on demand or on need. And it's a much more efficient model, and that's what we've done. We spent a year developing the capability in a research lab, spent a lot of time investment, talked to a lot of experts in the field, and realized we're creating a audiovisual production 22 times a day in that room. And we had to create automation and capabilities to do that consistently, and that's what we've done. That's what we're proud to be delivering to tribal nations right now across the country, and we've opened it up to other rural markets, FQHCs, community health centers, who also face the same issues.
So you saw a problem with the rural clinics that you guys work with. You saw that there was a lack of specialties, and I think traditionally everyone's trying to solve it by, let's call it traditional telehealth, right? Just have a call, right, on your cell phone or on your computer, on your laptop, on your iPad. How is this different? How is this? I remember the first time I saw it and I was blown away. That was a year ago. How is immersive care for someone that's never seen a OneRoom, never seen a care wall? How is immersive care different than your traditional telehealth visit that we got used to during COVID?
Yeah, no, it's a great question. So we all say this is not telemedicine. It has some components of it, right? Telemedicine is a way you can connect visually with somebody, have a conversation. So you get a little bit of a higher level connection than you would from a traditional phone. But there's challenges with that. I'm a telemedicine provider myself. I still do some visits, and you can't connect to a patient in a way you can in an office, right? I've seen a patient, the body language, their reaction, other people in the room with that patient, how they're responding to your questions, that back and forth. It's not a controlled environment. Often I do telemedicine with patients that are out with family, they're at an event, lighting, sound, connectivity is bad, they're distracted, and you're really, as a clinician, you want a really good evaluation in. It has its place in things, the simple follow-ups, things that we would bring a patient in the office for. This is much more convenient, and that's a great place for it. But when you really want to do a full new evaluation of a patient, examine them, understand a new problem going on, or if you're a specialist doing a consult, you really want to have a more in-depth evaluation, because you're going to make a recommendation. And as a physician, I want to make the right recommendations for my patients based on the best information.
So this is different because the patient is actually walking into a room, right? Just like they would into any exam room, and walking me through that process, right? So I walk in, I'm the patient. Am I dialing in? What happens if I'm walking into the clinic?
Yeah, so when we go to a clinic, a client clinic, and we install this technology into one of their exam rooms, that's just another room in which they normally bring patients in and out and schedule appointments. So that clinic still schedules patients into the clinic for now these expanded services they can offer to be seen in their clinic, in their room, on a scheduled day that they put in their calendar on their system. So the patient comes in as if they're going to see their primary care doctor or anyone else in that clinic like you normally do, except they're seeing that different specialist, maybe a cardiologist or a cancer specialist or a dermatologist who normally would not be in that clinic, but you could bring in this clinic technology easily, and they can see a patient as a per visit kind of way that they would be paid for. And to the patient, to the clinic staff, it's just another patient going to the room being seen. So what we do in that room is we install what's called a care wall. It's actually an immersive LED screen that gives you a full view of the doctor. So myself sitting in a chair, head to toe, you're looking at the doctor face to face, and the doctor seeing you on their end face to face and having a real conversation. There are cameras built into that care wall, microphones that allows the doctor to hear everything going on, so we don't miss the conversation. There are various camera angles that allows us to see people in the room, patients, and allows us to get a full view as if we're in the room with you. And then there's things that we build into it because it's digital that allows us to share information that you don't normally get to do. When I see a child, I look at their ear and I tell the mom that that child has an ear infection, the mom has to just believe, okay, Dr. Tamaru said I have an ear infection. What does that mean? We actually show that when we use the digital tools, and the medical assistant in the room puts that camera up against the ear and looks inside. The doctor gets to see what's going on. Then the doctor on their end can actually share that picture with the mom in the room on the care wall and show them what that infection means and what it looks like. That's powerful information that the patient, the mother now has, that's going to she's going to be much more attentive to that child, making sure they get their medication, take their antibiotic, complete it, and they understand why the child's fussy, having fever, not feeling well. So it goes way beyond just even traditional in-person care. It actually adds capabilities that you couldn't do even when I just see a patient in person in an office.
Because of the technology and the way you're able to display the information and actually share the information with the patient and those assisting the patient, right? Whether it's a caretaker, a mother, or father, or someone.
Well, that's the other point of it, right, Alex? You can actually, because this is all digital, just like we're doing Teams calls nowadays or Zoom calls, we could bring other people in that room as well. So my mother seeing her doctor in a city that I'm not close by, I can have a link sent to me through our immersive care wall technology that I can now be brought into that visit with my mom and her doctor as if I'm sitting in a room with her, listen, add to the conversation, and that's huge because most of us are no longer living, all family lives in one place. We're all over the country nowadays. So it's another advantage when you digitalize that experience.
So if I'm an FQHC leader or any healthcare leader, I work with OneRoom Health. I install this care wall in a 10 by 10, 8 by 8 room.
Mm-hmm.
I have my MA. I'm bringing in patients just like I would if they were seen any other provider. The difference is that the provider in this case is coming in an immersive way through the care wall, right?
Correct. Correct. They sign into a application we provide, a very secure application. They sign into it that puts them into ability to know that there's a patient waiting for them when that patient's ready on the application. It's almost like when I'm a doctor, I'm going room to room. I know that the next patient is in the next room waiting for me. There's a flag usually tells me that the patient's ready. Same system. So we created a similar workflow that doctors are used to, a workflow that a clinic is used to, and that the MAs are used to. So it follows the same logic of seeing a patient in any clinic, any office across America. There's kind of a standard workflow that most clinics follow, and we built the application to fit into that natural workflow. And that's key because often traditional telemedicine platforms are not platforms integrated into the workflow. They are standalone, right? Separate system, separate application you have to sign into, and that makes it challenging. And that's why I go to many clinics in rural spaces and see a telemedicine cart sitting in the corner of the office, and it's collecting dust. Or they rarely use it. Maybe the one person who remembers how to sign in there, hopefully they remember how to use it. But they're not using it as part of their daily routine. And that's the difference here. When we install it into a room, it becomes part of your normal rooming, your normal scheduling, your normal appointments that you usually are good about filling capacity in your clinic, and you're doing the same thing with these rooms.
So let's say I'm a COO or a CMO at an FQHC. I'm hearing about this one room solution. But I'm thinking it sounds great, right? It's very innovative, but my staff's already spread thin. We already have a lot of initiatives going on. What would you say to someone that has that thought process when they hear something like this?
I would say, given all the changes going on, revenue being tougher, more restrictions there, some things in some states where Medicaid eligibility is actually going down. I think clinics and businesses, healthcare clinics need to think about differently how they operate, how they provide services. So expand your service capability for your population, be able to do more for your patients you care for. That's what this technology could bring in efficiently, right? It doesn't require you to necessarily build another clinic. It requires you to dedicate a room and make that room now multi-purpose in its use rather than singular use. And that's the difference between this model. So yes, it's new, but really what you're doing is position yourself for ability to expand more capabilities to service your population that you couldn't do in a traditional way. I mean, are you going to hire a cardiologist, pulmonologist, allergist, pediatric specialist, oncologist? No, it just doesn't work. Through this model, you can contract those doctors to come and see your patients and do it affordably. It's almost like a per-click model, essentially.
Yeah, I remember when we talked about this, one of the thoughts I had was as a patient, anytime I've been referred to a specialist, number one, it's intimidating, right? Like, God, I gotta go see this specialist. Two, you're always going somewhere that you're probably haven't been to, right? So it's this new physician. You have no idea who it is. You have no idea where you're going. You got to show up. You got to make an appointment. And a lot of times you have to wait a while. My experience here in Nevada was I was trying to see a dermatologist. It was going to take 2 months to see a dermatologist. So I went through a telehealth company and got that taken care of faster. But I think as a patient, just to be able to go back to the same clinical setting that you're used to, there's a certain level of comfort that creates for that patient, right? Because they're going back to the same clinic they've probably been going to for years. They're probably seeing the same MA or some of the same MAs they've been seeing for years and seeing that provider in that way. So that was one of the things that I found interesting to, from a patient perspective, right? What
Yeah.
else do you think, or how else do you think that the one room is going to affect the patient experience?
So after COVID, we saw a lot of patients not come back to telemedicine as frequently, right? They need to come back in the office. I have a lot of chronic issues. My doctor needs to see me personally because I don't have confidence that they can manage this through a TV or a computer encounter. And when you come back in the office, they want to have that interaction. So immersive is a big part of that. When we say immersive, it's got to feel lifelike, real. The experience when you sit down in one of our immersive care rooms and you sit down and you're looking at the doctor and you see them life-size, high definition in front of you, your brain goes right to, I am talking to the doctor right in front of me. You're not distracted. You're not going to take your eyes off of it because that would be rude, right? I can't tell you how many conference calls I'm on where people are taking their eyes off and turning their cameras off. Well, you can't do that. And so you have that full attention right there in front of you. I think the other thing too is it's just there's so many things you can't pick up through traditional means like telemedicine, such as other people in the room. I'm talking to the husband about his hypertension, and he's telling me he's taking medicines, he's following his diet. I look at his blood pressure; it's still high, and I look at his wife, and she's shaking her head no. Well, that tells you everything, right? It's those subtle things that you have to be in the room for, and we designed the room to pick up on all that cue. Now, there are things we also have in the room that it's capable of doing through new AI that's developing, things that can recognize facial expressions, like is the patient look confused? Do they look anxious? Are they, not understanding what's going on? Those are things that we could pick up through the digital signals and easily help cue that up with the doctor so that they get better intel as well. Because if I see that come up and I realize the patient is not understanding what I'm saying, I'm going to slow down. I'm going to try to restate what I said in a much more way that they maybe understand better. And it's those kind of things that you don't get in real life, but you now get through this digital experience.
Right. Do you foresee? So I'm an FQHC leader. I said, great. I want to try this. I'm going to install this. I'm going to make the investment and work with the OneRoom to deploy this. How much work does it, once it's installed, that's part of it. How much work does it actually take from my staff to understand the technology, to understand how it works, and for me to start seeing patients through the OneRoom solution?
Yeah, so as I mentioned, workflow, we kind of follow the same workflow of any MA who rooms a patient, right? They know the patient's in front, they get a tablet that tells them the patient's arrived off your schedule. We get the feed from your schedule. They bring the patient back, they room them, they get all the exam, vital signs done, and then the vital signs automatically upload to the doctor on the other end. When a doctor's ready, they come in the room, they see all the vital signs, just like my chart before. So it's following that natural workflow that typically happens, right? And then most MAs are used to using the basic tools, right? They look in the ear, they often do ear lavage, irrigation. They look at the eyes and throat sometimes, and they use a stethoscope. A little extra training on the positioning of the stethoscope, but all those digital tools are in the room as well, and it transmits either sound, pictures, video, right to the doctor, where they can review it and see it and evaluate that. And so they get a full examination of the patient through these tools. So it's really not that hard for patients patients, it feels normal to them. You have someone still in the medical assistant. The only difference is the medical assistant doesn't room the patient and leave. Often they may stay in the room with the doctor if the doctor wants them to do some additional exam and use the tools. If they don't want to, that medical assistant can exit the room. So that's probably the only big difference when you use this type of technology. But essentially, it's nothing different than most medical assistants are used to. A little extra training on positioning of the tools. And then the software is just intuitive. It follows that natural workflow. So it's not like they're doing something different. They're just doing what they normally would intuitively think they have to do when they're taking the patient back to the room.
Got it. What are some of the, I think some of the questions are going to come up is, what are some of the specialties that can be done through this model, right? Because at some point, in some cases, the specialist does have to put hands on the patient, right? But what are the specialties you see that can be done through this model today?
Yeah, a lot of the general medical specialties are perfect for this. Endocrinology is big out there. Rheumatology, neurology can be done as well. Pulmonology, asthma, pediatrics, and some of the pediatric subspecialties as well. Cardiology is a big one. We have a cardiology group that's going to be using our room very soon from a big hospital group. So it's wound care, dietary. You can do some basic physical therapy even if you want to, speech therapy. It's really, that's why we look for clinics we're working with early on. We're looking for innovative clinics who are willing to test the system to its limits, right? What else can we do with this? What else can we use it for? School-based programs. We have some tribal nations who are looking at deploying this technology, putting it into their tribal schools, and then rather than going to the nurse to see someone, they can actually have a physician visit or a clinical visit at the school, where often that's much easier for them to get their care at. So lots of different ways you could use this modality. Put it in a senior center, and then at that senior center, you could have a small clinic there, bring the specialist, bring the geriatrician into the room as well on certain days when those seniors are at the senior center. Lots of different applications.
Yeah, I know we talked about mostly FQs, but in other conversations, we talked about how this could also be very beneficial for PACE programs, right?
Yeah.
Because they're responsible for the whole care of the patient, and if you can bring that specialty in-house, I think this could be powerful for PACE programs. But I want to go back to something you mentioned, was the ideal partner for OneRoom Health today is someone that's innovative, right? So what does a profile of a healthcare organization, whether if it's an FQ or a hospital or a PACE program, what do they have to have on their end to be a good partner to One Room Health?
Yeah, I think those who have come to the realization that traditional brick and mortar is not how care is going to be solely delivered, and that you have to think about using and embracing some of these newer technologies. As AI comes into play, you're going to have digitalization of the environment. And if you don't have that, you won't be able to really capitalize on many of the tools that are out there to help clinicians help patients more efficiently and get to the right diagnosis faster. Convenience is a big issue, right? You live in a big city, you think that's easy to get around. It's not. It's just as challenging as a rural environment sometimes. And to bring the care to more single access points where you can get more care at a single point location, expands the health system, expands the capability of that system, that's better. We have a shortage deficit in many areas of the country, and this helps to address some of that.
Yeah, I remember when I first saw this One Room and thinking, man, I remember being a kid. We didn't have a car. We had to take a bus everywhere, right? In LA, it was a RTD back in the day. So it was a mission just to get to the provider. And then when the provider said, oh, you have to go to a specialist, it was like, okay, well,
Yeah.
one of my parents had to take the day off. How many buses? What time? It was a whole mission for us to. And are you really that sick? Maybe not. Drink some 7 Up. You'll be okay. And let's wait it out, right? Depending how serious it was. So, yeah, I do see there's a fit for this in urban areas, rural areas. Just overall, I think the limit on specialty access, it's huge, especially for those on Medi-Cal. So looking at the rural health transformation bill and what's happening, and everyone's trying to figure out where that funding is going to go to and how can they participate in that. Where does One Room Health fit into those innovative ways that this bill is pushing healthcare towards?
Yeah, no, it's interesting. So the Rural Health Transformation Fund, the $50 billion that was put out by the federal government. So that's an allocation of money, and whether you believe that's total funding, Medicaid goes down for many people, but this is actually accessible money for infrastructure development, right? Part of that funding bill request by CMS said that any states to apply for this, they have to have certain parameters in it. One is, innovative care models, so ways you can deliver care and improve access to care. Really, immersive care really does check that box. It's probably expands the ability to bring in multiple types of specialties into a region that you normally couldn't. Two, it's workforce development is another key one, right? So as you think about developing higher levels, people to function at higher levels of their capability. So take an MA now it's operating digital tools on behalf of that doctor. That's a little bit higher skill set. They're actually going to be in the room with the doctor many times as the doctor's kind of going through the interview and the diagnosis. That's a fantastic position to be in as a medical assistant or an LPN or a nurse even. So it elevates the whole workforce when you bring this type of technology in. That's a whole workforce development that the grant really wants to encourage. And then just the pure technology is spelled out, like how do you use these virtual and telemedicine technologies to expand the care? And the whole goal is to be able to create a sustainable system with these investments. Because these are being done in a clinic and we're digitalized environment in the clinic, the doctor may be remote, but the patient's on site. These are like office visits. And so there's an established reimbursement there that exists that these services get paid for. So it's not like you're asking for a new reimbursement or a new way to reimburse for this. There's existing ways to pay for it, which makes it sustainable as well.
That makes sense. Is there anything we haven't covered that you would like to share, that you would like people to know about yourself or about One Room Health?
Yeah, like I said, I spent 25 years, 30 years in healthcare. A lot of it was around thinking about how do we improve the delivery of care. I spent 6 years in the military as well as a Navy doctor, delivering care anywhere, under any circumstance, under any condition. And I think that's similar to how we're trying to think about healthcare today, right? It's not just in the hospital or office, it's at home. It's other places. It's mobile modality. It's through these immersive care technologies we bring into the office. So I think thinking more broadly about how you can deliver care in multiple ways, to the population is something I've been passionate about. This really is, I think, one of those things that I really believe can change the way we deliver care moving forward.
Yeah, yeah, I agree. To close things out, when you hear the term "build what matters," what does that mean to you when it comes to in the context of healthcare and community? What does that mean to you?
Yeah, I think it's around building things that actually can have an impact, right? And when we talk about healthcare, it's about improving the quality of life, the outcome, the health of the population. And if you're building something that can touch that, make an impact, you're building something that's worthwhile, right? I see so much technology in healthcare without a real goal of what's it really designed to do. And I purposely designed this system for that purpose of what we're trying to meet in terms of access to care, specialty, and getting people care faster that they need and get their answers, right? You can get your care now and sooner, you're going to be better off than if you have to wait, you're delayed to see a specialist.
Absolutely. Dr. Tamaru, thank you so much. It's a pleasure. We appreciate you taking the time to meet with us. Thank you for you and your team putting all the work into innovating this great solution. So we thank you for your time.
Thank you, Alex. You have a
All
good
right.
day.